Welcome to the Adoption and Foster Care Journey, a podcast to encourage, educate, and equip you to care for children and youth through adoption, foster, and kinship care. Hosted by an adoptive mom with over 22 years of kinship and adoptive parenting experience. She's on this journey with you. Please welcome Sandra Flach.
Therefore, as God's chosen people, holy and dearly loved, clothe yourselves with compassion, kindness, humility, gentleness, and patience. That is Colossians chapter 3, verse 12. I am Sandra Flach, your host. Welcome to this episode of the Adoption and Foster Care Journey. I am thrilled that you're joining me today for some encouragement and to experience some community for your parenting journey. Raising kids with trauma is hard, and if they were prenatally exposed to alcohol or other drugs, well, that's another level of hard, right? And I know it because I'm on this journey too. So you're not alone. We have got a whole community of fellow parents and caregivers who are also on this journey. We are all supporting each other, encouraging each other through this podcast, through the support group, through trainings that I do, through our social media. So I'd love for you to listen to this little commercial, so to speak, about our support community. Check it out.
Sandra Flach, host of the Adoption and Foster Care Journey podcast, and FASD educator Debbie Raymond, invite you to join Hope for the FASD Journey, a virtual support community for parents and caregivers raising individuals with fetal alcohol spectrum disorder, diagnosed or not. This faith-based support community meets online 3 times each month, features special VIP guests, and a private Facebook group for members only, which includes Soul Care Saturday video devotionals led by Sandra and Deb. Both Sandra and Deb are adoptive moms raising kids with FASD and facilitators of the Facets neurobehavioral model. For details and to register, visit justicefororphansny.org/hope-community. That's justicefororphansny.org/hope-community.
Most parents and professionals don't even realize that fetal alcohol spectrum disorder is the leading cause of developmental and learning disabilities worldwide. Like, it's everywhere, but it's so little known. I just had the opportunity in our support group. We had a VIP guest who I'm hoping to get on the podcast soon. She's a young woman. Maggie May is 27 years old. She was the first person ever diagnosed with an FASD in the country of Ireland. I think she was 6 or 8 years old when she received her diagnosis. So it is everywhere. And we just had such an eye-opening conversation with Maggie May. Like I said, I hope to have her on this podcast soon. She was a VIP guest in our support group, so we got to hear her story and ask her questions. But it is everywhere, but it is not known or understood by so many people, and not just adoptive and foster parents and kinship caregivers, but school teachers and even doctors and pediatricians and people who you would think would know, should know. They really don't. And this is so prevalent. It's 1 in 20 school-aged children in the United States have been prenatally exposed, higher than autism, which I believe is 1 in 35 or 36. And it really affects a vast majority of kids in foster and adoptive placements, kinship placements, group home placements. But most are not diagnosed, or our kids often have that whole alphabet soup, I call it, of diagnoses, from the ADHD, ODD, ASD, PTSD, like all of the things, right? And those may be accurate diagnoses, but most likely they're coming under the umbrella of fetal alcohol spectrum disorder. So, as a mom, my boys are now soon to be 19 and soon to be 21. Both were diagnosed with fetal alcohol syndrome when they were little. And I spent years trying to figure out what is going on here, right? We got the trauma training. We had TBRI, Empowered to Connect, and all of those things, which worked. And we had attachment and connection and a lot of good things going on. But, there's always just something, like there's something else going on. And that's when I took my deep dive into FASD, because we had a diagnosis, but we had no understanding beyond that. So I don't want you to be on this journey alone. And while this podcast isn't just for parents and caregivers dealing with FASD, it is for all adoptive, foster, and kinship caregivers, and even professionals working with families and children. But so many of us are affected by FASD and don't know, or do know and don't have any resources. So I want to make sure that when you tune in, you're learning about it, you know about it, and you know where to go to get more training and support. So you heard about the support community. I also offer online and in-person FASD workshops and trainings, as well as one-on-one parent coaching. I do travel. I'll be at a Christian Educators Conference in Western New York in August. And I will be at the Christian Alliance for Orphans in Nashville in September. And I will be at Replanted in Chicago in October. And another child serving agency conference in upstate New York in November. So I will travel, and I love to connect with people and talk about FASD. So I do that as well. But you can also take advantage of all of the trainings that I offer online. So coming up for August 2024, Wednesday, August 14th at 7 p.m. Eastern, I am offering a free Intro to FASD online workshop. It's live and interactive. It's not a recording, so you can check that out. And on Thursday, August 22nd at 10 a.m., I've got a 3-hour FASD workshop that is, both of those workshops will unpack the impacts of prenatal exposure, the symptoms of FASD, and how to take a brain-based approach to parenting. I use the Facets neurobehavioral model for that. So the 1-hour intro is free. There's also the 3-hour, which takes it a little bit deeper. And there's a small registration fee for that one. And you would register for any of these workshops on my website. And I don't want to forget to let you know that if you really want to be all in and go as deep as you can go, in October, the beginning of October, I'm offering the deep dive into FASD. It also uses the Facets neurobehavioral model. And this is 6 consecutive, I shouldn't say consecutive, it's once a week, 6 3-hour sessions. We offer it once a week, 3 hours each time, until we've covered our 18 hours of content. That begins in October. The dates are on the website. To register for any of the workshops, you could go, or even, and the coaching and the support group, you would go to the website, justicefororphansny.org. And then there's a tab that says registration. There's also a tab that says training. Either one will get you to all of the resources that we have for FASD. So make sure that you check that out. And also, if you want to read a little bit more, I have a whole blog post series where I dedicate a blog post per each of the symptoms of FASD, each of the primary symptoms. And I sometimes add a blog post in there about other things as well. But my personal website, sandraflach.com. So if you want to read more about FASD, you can check that out. And of course, Please subscribe or follow this podcast, leave a review, all those things that all of us podcasters ask listeners to do, because it really does help us reach more listeners. And that's what we want to do. We want to be able to encourage and equip more adoptive and foster parents. We also have a YouTube channel where all of the video versions of this podcast live now. So our YouTube channel is at Justice for Orphans. So I hope that you will check that out too. So all of that to say, let's get to our guest, our favorite returning guest and resident doctor. Dr. Jerrod Brown is back with us today. And Dr. Brown is a professor, trainer, researcher, and consultant with multiple years of experience teaching college-level courses. Jerrod has also provided consultation services to a number of caregivers, professionals, and organizations on the topics of autism spectrum disorder, FASD, confabulation, suggestibility, trauma, and other life adversities, traumatic brain injury, and youth fire setting. Jerrod has completed 4, yes, I said 4 separate master's degree programs and holds graduate certificates in neuropsychology, autism spectrum disorder, and other health disabilities, and traumatic brain injuries. In 2021, Jerrod completed a post-doctoral certificate in leadership and organizational strategy from Walden University and a professional certificate in forensics psychology from San Diego State University Global Campus. Jerrod has published several articles and book chapters and is also regularly featured on several national and international podcast programs like this one. So grab a notebook and a pen or a pencil because you will want to take notes anytime he speaks. Please welcome back Dr. Jerrod Brown. Welcome back, Dr. Brown.
Thanks for having me. Great to be here.
Well, as always, we are so grateful to have you. You are like our resident expert on the brain and the body and all of those areas of importance for us adoptive and foster parents. And speaking of which, you are a foster parent. How's it been going with your little one?
Fantastic. I love it. Life-changing, makes me a better person, slows me down, learning a ton, and then seeing how all the things I've been learning in school and in the research actually play out in day-to-day life. And it doesn't always play out that way. So you can talk a good game, but sometimes modifications need to be made. So
yeah. Well, I love the fact that you've got, both feet in this world too. So you're getting to apply it and live it and have that lived experience. And because everything that you've taught us is, your episodes when I interview you are some of our highest downloaded or listened to episodes ever. You bring so much to the table. But it's also great to that lived experience. There's nothing like that. So thank you. I'm thrilled that you're having that experience. And we have a very interesting topic today, one I don't think we've tackled this. This is hormonal dysfunction, what all foster care and adoptive parents need to know to be informed. So, Jerrod, what exactly is hormonal dysfunction that we need to know about?
yeah, I would suspect most of your audience probably have never thought of this topic. And once we're done today, I think you'll see why we have to think about this. We've talked about topics that relate to this, like the HPA axis. We've had discussions about that. The HPA axis is a hormone regulator. So take that into account. We've talked about the gut-brain axis. That plays a huge role in hormones. So if you have a child and their gut is off and they're dealing with high stress, they're not eating well, their hormones are probably not working properly. If you live in this country, your hormones are probably off. Just the very nature of the go, go, go mentality, the Western diet, lots of sugar, lots of stress, screen time exposure. We all deal with this on some level. If you miss a night of sleep, that throws off our hormones. If you're having tons of coffee in the evening hours, lots of caffeine, if you're having an argument with your spouse, if you have issues at the job, anything that's causing you stress, that can throw off our hormones. And when you study hormones, you have to understand the endocrine system. So I'm sure some of you maybe have worked with like an endocrinologist if you have like some sort of maybe it's thyroids or there's a million disorders out there, but the endocrine system is really kind of this big network of glands that produce and secrete and release hormones into the body. Hormones play a role in everything. I did not coin this term. There's a book that's written. I don't remember the book, but the author said that hormones are like the body's Wi-Fi. So if your hormones are off, the connections with the rest of your system is not working properly in a lot of cases. If you have diabetes, if you have a thyroid disorder, if you have serious mental health challenges, you probably have hormonal disruption of some sort. So we all deal with this on some level. Cindy, I can't remember. Did we do a recording on psychoneuroimmunology? I can't remember at this point.
That one does not sound familiar.
Another big term to be aware of, and psychoneuroimmunology studies the interconnectedness between like the brain, the body, our hormones, our gut, inflammation, our mood state. That would be a field of study to at least be aware of. And I spend a lot of time in that literature. The reason being is because if you have a child that has complex medical or behavioral health issues, I do think that field of study is more of a holistic approach that looks at the whole person, mind, body, connections, what's going on with the behavior, our mood state, how that impacts our brain, how that impacts our cortisol levels, how it impacts our gut, how it impacts our sleep. So psychoneuroimmunology, big topic to be aware of. So hormones are a huge topic. I mean, there's tens of thousands of articles written on this, but the easiest way to think about this, the body's chemical messengers. So when our hormones are working properly, they send these chemical messengers to all parts of the body, and that just helps our body work better. When we have good working hormones and our body's in sync, that plays a role in positive growth and development. So you're thinking about child development. This is another big topic to be aware of under that umbrella. Metabolism plays a huge role. If somebody's trying to lose weight and they can't lose weight, their hormones might be off, their gut might be off, their sleep might be off. So looking at it holistically with a doctor, of course. If your child has these up and down, just crazy mood swings that do not make sense to you, that's a good sign their hormones are off. Again, there's other things going on there too, but definitely blood sugar dysregulation. I know we've talked about that in few previous episodes. If you skip meals every day for breakfast, your blood sugar levels go down. If you're one at lunchtime to go to the buffet and have like 5 to 10 plates, not good. We all know that. That spikes our blood sugar levels, crashes them. Those things throw off our hormones. So hormones impact so many different things. Those are just a few things to consider. And if we look at this just from that psychological state, therapists, social workers, case managers, if you work with people with anxiety and depression and lots of psychological stress, you would benefit from learning about hormones because that really helps better understand our mood state at kind of a biochemical, biomolecular level. Sandy, I'm going to kick it back to you for a minute, see what you think.
Yeah, so it makes me think of our children who come to us through adoption, foster care, kinship, who've all experienced, levels of stress, trauma, prenatal exposure. So I can only imagine that hormone levels have to be really out of whack in those instances. So can you break that down? Like how does the trauma, the stress, prenatal exposure impact hormone levels in our kids?
Well, if we take it a step back, look at what's going on in utero. So mom's pregnant. What are the factors that impact fetal development? What mom eats, or the lack thereof. If mom's overweight, that can impact fetal development. People are surprised to hear that. If she's dealing with any kind of trauma, maybe it's domestic violence, maybe it's trauma that we don't expect, like she just lost a job, they're going through a divorce. Maybe there's a lot of unresolved conflict. Anything going on with mom while pregnant obviously can impact fetal development. Genetics definitely is a factor, but mom's hormonal state is talked about in this research literature. So another factor to consider if you're working in the arena of helping women have healthy, safe pregnancies, learn about hormones. Learn about ways to regulate hormones, working with healthcare providers who understand these topics. So this is a factor that does play a role in fetal development. So fast forward, the child's born, or you as a caregiver, what can impact our hormone levels? Again, stress. Any kind of stress, especially uncontrolled stress, things that are just out of control, like toxic stress exposure, things like that. If you're dealing with a lot of unresolved conflict in your day-to-day life, just look at your family system, look at your coworkers, look at your neighbors. If you're dealing with a lot of unresolved conflict, and maybe let's say that child gets into school and they have really poor coping strategies. They're not too good about problem solving, making good decisions. They're not good about how to calm their brains and body down, and they just seem to have conflict all the time. That can impact hormone health. Sleep is one of the primary factors to consider when we want to optimize hormone health. So if you are one that just doesn't sleep, maybe you have undiagnosed sleep apnea, maybe it's insomnia, maybe it's trauma-related nightmares, any kind of sleep disturbance can impact hormones. So targeting sleep, getting that under control, not to go down too far of a rabbit trail, but there's research that does show that children that have a lot of sleep disordered breathing and even lots of snoring, some research says that if you treat that, symptoms of ADHD or conduct disorder or oppositional defiant disorder may go way down. So before diagnosing a child who presents with all of these erratic behaviors, has anyone ruled out sleep issues or snoring because maybe at night they're not getting enough oxygen and they're waking up frequently and they're dealing with undiagnosed sleep apnea? Something to consider just to keep in the back of your mind. Obesity, if someone is overweight, that's really a state of being in chronic low-grade inflammation. So we know, unfortunately, obesity rates have skyrocketed in the United States, and more people than not are overweight in this country. Weight status does play a role in hormone health. If you are one that doesn't move a lot and you're a couch potato or whatever term you want to call it, and you're just glued to the screen and you live a sedentary lifestyle, sedentary behaviors can impact hormone health. So getting out, moving, just going for walks, whatever it is, get moving, that can be very, very helpful. We've talked about nutrition some. Again, we're not giving nutritional advice here, but if you're one that eats fast food, ultra-processed foods, foods that fall under the Western diet, basically that's foods, if you look at the label, you can't pronounce half the things that are in there. And it's loaded with salts and sugars and preservatives and emulsifiers and thickeners and things like that. And most of your food you eat is microwaved or comes from a gas station. That's Western diet food. What we eat plays a huge role in adversely impacting our hormone health. Caffeine can impact it, drugs, alcohol, tobacco, even exposure to environmental contaminants. So if you live very close to a busy freeway or maybe right across the street from a factory, environmental contaminants, air pollution exposure, definitely things to consider. Puberty can impact this, menopause, iodine deficiency, eating disorders. I mean, the list goes on and on and on. And that's why I say probably most of us are dealing with this on some level. But the more of these things going on for someone, the higher likelihood, obviously, they're probably dealing with more severe kinds of hormonal dysfunction. And if you look at the abuse literature, trauma, abuse, even dysregulated attachment patterns play a role in the hormonal health discussion.
It's so fascinating. And I do think of the children that come into, because so many of our listeners are adoptive and foster parents, and our kids are coming in, no matter what age they come in at, have experienced some level of loss, trauma, probably some form of malnutrition or, lack of good nutrition at the very least. And with all of that, you got to assume that there are some sleep can't be all that great for our kids. So you can see how the likelihood, or maybe that should be a question, is the likelihood greater for children and teens who are in adoptive placements, the foster care system? Are they more likely to have some kind of hormonal dysfunction? And if so, are there symptoms? Like, what should a caregiver or a parent be looking for when they, and then come to the conclusion that I need to get some kind of testing done? So what would be the symptoms?
Negative mood state, definitely, like, especially if it's a negative mood state where it's not related to a certain situation, which it could be. But if that person is irritable a lot and they're just in a bad mood all the time, fluctuations in hormones and neurotransmitters should be considered without a doubt. Fatigue, another red flag indicator. Again, there's a million causes for fatigue, but ruling out hormonal dysfunction can be a huge thing. Insomnia, unexplained insomnia, definitely. Again, if you have a teenager, puberty relates to this. So hormonal changes, definitely. Shift change work, if you're someone that works shift change, like maybe 2 weeks you work one shift, the next 2 weeks you work a different time, this up and down swing in your shift, so circadian rhythm misalignment, that's something to be aware of. Interestingly, too, hormonal dysfunction may play a role in food cravings. So if someone has a lot of unexplained food cravings and they overindulge in food and they just kind of stress eat a lot, something to be on the lookout for. Another tip I'll give you, if any of you are working in drug and alcohol treatment programs, you're working with someone or you have a child, teenager, adult who has addictive tendencies, some research does point to the fact that hormonal dysfunction could play a role in increasing one's cravings to use alcohol or other substances. Headaches have been linked to this. Again, there's a million factors that can cause a headache. But if the more of these symptoms, red flag indicators that you're seeing, talk to your healthcare provider. There are different tests out there. Some healthcare providers probably do have knowledge in this. In my experience, the people that seem to have the most knowledge about hormone health is going to be your functional kinds of medicine people, functional nutritionists, some medical doctors who have functional training, but there's a lot of different tests out there for this. So definitely you can test for this. I can't recommend any particular one. A lot of times these tests usually are self-pay in my experience, but again, it depends on insurance, your state, and things like that. But unfortunately, if you do go to like a functional provider, a lot of times that's not covered by insurance, and some of these tests are quite expensive. But I do know people personally who have gotten these tests. They get this fantastic data, and then what do you do to target it? You change your diet, you change your lifestyle. Maybe there's some supplements that someone prescribes where maybe you're low in a particular area, and you would never know that if you didn't get tested for it. So those are a few of the symptoms to be on the lookout for. But again, a lot of these symptoms can be caused by so many things. But just assume, again, if you have a child that has a long list of mental health diagnoses, they've had a long list of trauma, particularly prenatal exposures to drugs, alcohol, or any other chemicals. I can't quantify it. I can't say like 50% of these kids are going to have hormonal dysfunction, But if we look at the research and apply it, it seems like a very high percentage of children who are in the child welfare arena would likely have this. I say that because of high rates of trauma.
Mhm.
A very high percentage of these kids have sleep issues. I do a lot of training in sleep, and if you look at the FASD literature, some of the stats put the range between maybe 60 to 80% of kids with FASD actually have sleep issues.
Mm.
And if we had the prenatal alcohol or drugs or any other chemicals in utero, the exposures to the brain and body, we all know that it impacts like executive function and all of these things. But sometimes people are surprised to learn that some of these chemicals can also disrupt circadian rhythm in utero. It can
Mm.
impact hormonal health. It can be a contributing factor to metabolic dysregulation, higher levels of inflammation, autoimmune issues. So very, very complex things going on when we're working with kids that have been exposed to chemicals in utero.
Yeah, I find it to be fascinating, and I can grasp it too at some level. I mean, I'm an older woman, and I was having some issues, and I went to a holistic doctor, and she actually did hormone testing, and told me up front with the symptoms that I was experiencing. She said, I highly suspect that your hormone levels are too low, but your cortisol level is probably too high because, when I explained I'm a mom, I have kids with special needs, there's like all these things going on. And after the testing, it came back exactly as she suspected. My cortisol level was through the roof, and my and other hormone levels were bottomed out. And I just used some all natural, supplements and remedies to adjust that, and also at the same time understanding that I needed to get serious about cutting out the sugar and get more serious about taking some evening walks, and getting a little more exercise. And it made really a huge difference, being able to address those things. So it affects, because I would find myself at 4 o'clock in the afternoon, like I'm ready for a nap. I don't want to make dinner. I don't want to clean up dinner. I don't really want to do anything. And it's only 4 o'clock. So something needs to be done because my day is not done at 4. So, but just with even the all natural supplements that I was using, and then taking that afternoon walk and cutting out the sugar, it made a huge, huge difference in me. I can only imagine with our kiddos who've had all of the prenatal and childhood trauma, what their little systems are, this must wreak havoc on them. So then there is testing that can be done. So, we can pursue. Is that what would we say to a doctor? Would we go in and say, how do we ask for this kind of testing for our kids?
Well, I would ask, do you do hormonal testing? Depending on that child's complex history,
Mhm.
in some cases, that primary care doctor may refer that child to an endocrine specialist. It's possible. Some clinics I know do have integrative medicine. That might be a good thing to look into because in integrative medicine, usually they're going to have training in nutrition, and I would assume hormone health. Something to look into. Talk to your pediatrician too. Maybe they have a good referral to a good functional medicine specialist that they know that they trust. That would be an area to look into. Anytime we're talking about these things, I think it's imperative to rule out sleep issues, gut health problems, and even issues with like insulin and blood sugar levels, because they all a lot of times go hand in hand.
Yeah.
And the research literature does indicate that kids with some of these neurodevelopmental disorders do have a lot of gut issues. There's some research in the autism world that says as many as 90% of kids with autism have gut issues. There's emerging evidence coming out in the FASD world, which we all have known for years, and it's finally coming out in published articles that, yeah, people with FASD typically have more gut health issues as well. So that would
Mm.
be a starting point. One thing I'll say too, most of the work I do is in the area of like forensics and criminal justice arena stuff. So in that world, it also talks about ruling out hormonal dysfunction when we're talking about criminality or really complex behavioral needs. And I do a lot of work in the area of domestic violence as well. I give a lot of trainings on that. And you're going to find a whole line of literature that talks about hormonal dysfunction in combination with neuropsychological issues, maybe some driving factors around intimate partner violence as well. Not the only factors, but you're going to find research on that as well.
Wow. Fascinating. And kind of to circle back around when we're talking about the food cravings, if the hormones are off, the food cravings. And I know it can be common with kiddos with FASD where some of them can have intense sugar craving. Like one of my kiddos would rather drink sugary beverages than even eat food. It's, not the typical, teenager wants junk food, but just would rather have a sugary beverage than even consume food. So could that be, a sign of hormonal dysfunction? What could be involved there?
Yeah, I mean, look at it as a big puzzle. I mean, that's definitely a big part of it, I think. Impulse control issues come to mind, which that would be executive dysfunction, self-control deficits. What was going on in utero with birth mom? Was she consuming a high degree of sugar? So we have some fetal programming kinds of things going on as well, maybe. Learned behavior could be a factor. Limit setting, I mean, all these things definitely come to mind. From a neuroscience perspective, again, it can have kind of similar addictive tendencies. There's controversy in the research on this, but I do believe sugar is addictive. I've seen it I've seen it firsthand with people I know. So looking at some of the neuroscience data on how our brains light up when we have sugar, similar to how our brains light up when we're using drugs and chemicals. And another tip I'll give you from a neuroscience perspective, any of you studying addiction, you would want to learn as much as you can about the part of the brain called the striatum, especially if you're in drug and alcohol treatment programs. That plays a huge role in addictive behaviors. It's called the striatum.
Wow.
We could definitely do a recording on that in the future if you want or something.
Yeah, that's fascinating because I have heard that individuals prenatally exposed to alcohol, and I don't know if this is scientific fact, right? So maybe you can straighten it out for me. But I've heard that people who are prenatally exposed to alcohol tend to have those intense sugar cravings because of the alcohol turning to sugar. And I've always wondered, like, is that really a thing, or or they're born predisposed to addiction and sugar's just like the first thing? What are your thoughts on that?
Not enough evidence to say conclusively from my standpoint, but there are genetic underpinnings that we would need to be aware of course. And again, what was going on in utero with birth mom? Was she again addicted to sugar and sugar sweetened beverages? It is a layer to this without a doubt.
Yeah.
I don't remember how many studies or articles have talked about FASD and sugar. Don't quote me on this. Maybe there's like 6 or 7 that talk about in some of these studies, and they're very small sample sizes. They did find that people with FASD seem to have more of a challenging relationship with sugar compared to the control group. And I've seen it firsthand in the cases I consult on. Some of the cases I can think of on just off the top of my head, there was no off button in that person's brain. And they just kept eating and eating sugar and sugar. And these clients, nearly every one of them had type 2 diabetes as well. So it's a threat to human health. Excessive sugar consumption, it's a threat to human health, and it's a threat to hormone health.
Yeah. So getting back to the hormone dysfunction, say we get our kids tested and things are out of whack, so to speak. What then can we do? Like how do we correct it? What are some things that a doctor or a specialist may do to help straighten out the hormone dysfunction?
So as you know, I'm in a nutrition program now. I can't give nutritional advice, but just in general, talk to your healthcare provider. But general things Consistent meal times can be helpful. Some of you might be interested in the field of precision nutrition or chrononutrition, where we really pay attention to when we eat, the timing of the food, and our circadian rhythms. And there's some evidence that points to the fact, and again, don't go out and do this unless you talk to your doctor. Every person's wired differently, but in a nutshell, some of the research says have a 10-hour window of when you eat. So when you get up in the morning, try not to eat right away. I've heard this a few times where it takes about an hour for your body's organs to kind of wake up. Start your first meal after an hour after you get up, consistent meal times, and then end your last meal of the day sometime between 5 and 6. Nighttime eating, not too good. But again, it really depends too, because there's a lot of variables. What happens if someone has blood sugar issues and they do need to have more snacks through the day? So it's a very individualized. Some of this research also says maybe look at the Mediterranean diet. That does talk about enhancing hormonal health. The Mediterranean diet, you're going to have a heavy emphasis on fruits and vegetables, nuts, fish, not going to have processed foods. Try to eat organic when possible. You're going to have probably more omega-3 fatty acids in your diet. So there's a multitude of studies on the Mediterranean diet. I have not ever seen a study on the Mediterranean diet with people with FASD. So if you're a researcher, great thing to look into. From a nutrition standpoint, it does say have plenty of fiber, have plenty of protein, healthy proteins with each meal, engage in exercise, reduce sedentary behaviors, maintain normal weight, reduce your stress, get better sleep, all the things we know that are good. And Sandy, how familiar are you with oxidative stress?
That's a new one, oxidative stress.
Oxidative stress, so it's kind of an imbalance between free radicals and antioxidants, and oxidative stress when it gets to be too much in our system, which again, if you're a go person, you're skipping your meals and you're going through the drive-through, you're getting a cup of coffee quick and a donut in the morning, and you're multitasking, you're not sleeping, you're probably dealing with high levels of oxidative stress. So in order to get our oxidative stress down, which can be just as effective in helping our hormones, it talks about yoga can be helpful in some cases, meditation, staying hydrated. I know people, even family members, I'm not going to name her, but my wife has a tendency to drink too much coffee and not enough water, and staying hydrated with water, even practicing deep breathing is a great strategy. So these are just basic things. We all know that smoking cigarettes isn't good. You want to throw off your hormones? Have a cigarette. If you want to increase your oxidative stress, have a cigarette. I mean, not good at all. Very, very bad for the body. And depending on, again, your mindset, who you work with, there's all kinds of adjunct kinds of approaches and therapies out there. Prayer is talked about in the literature, massage, music, pet therapy, animal therapy, reflexology. I mean, there's a multitude of things that are talked about. But again, talk to your healthcare provider because everyone is so different. It really depends on a multitude of factors. But in a nutshell, those are kind of the big things that come up in the literature in terms of interventions for hormonal health from kind of a holistic, integrative lens is where I come from. You talk to a medical doctor, they might say medications, not against medications, but I look at it usually through that functional lens.
And would it be a functional doctor, a nutritionist who would point people in the direction of, supplements and things like that to do an all natural approach? Like, because I have supplements that I take.
Yeah, naturopathic doctor, someone with an ND after their name, naturopathic doctor, functional nutrition. Some medical doctors are trained functionally, but a lot are nothing against medical doctors. They're way smarter than me, but typically medications is the route. But that only goes so far, in my opinion. You got to get deep in the weeds. What are the causes? What's
Right.
causing this? And it's usually not one thing. It's probably a multitude of factors.
Yeah. Because I mean, I always go back to our kids and think, the stress that they came from in order to be in our homes, right? Prenatal exposure, stress in utero, and then whatever childhood trauma was happening, kids with those adverse childhood experiences, higher stress levels, and then, the hormones are going to be out of whack. And then how can we help our kids? I guess that would maybe be my next question would be maybe what would be the top three things that if as our listeners are tuning in and thinking, I'm sure the children I'm caring for probably have some hormonal dysfunction. What are the top three or the first three things that a parent or a caregiver should do if they suspect, the hormones may be out of whack, and if it's something that we can adjust, things could get better and this child would be healthier. What are the top three things would you say a parent or caregiver should do?
Work with your healthcare providers first, but then
Mhm.
optimize the gut. Start there. That's the hub of immunity. A lot of our hormones are produced in the gut. And there's gut testing out there, but again, usually Western medicine, you can't get it there. Most cases, it's usually you need to get it through a functional person. And I know people who have done that, and they cost around $300 to $500 depending on the test, but it
Mm,
provides a wealth of data. Anytime you can optimize the gut, you're optimizing all of human health. Get
mm,
sleep under control. If
mhm,
there's sleep issues, fix that if possible. And then be aware of what you are eating, when you're eating, how much, what's in it. And it's complicated because that's why you need to work with a healthcare provider because
mhm,
somebody could be eating all the right foods on paper, but maybe they're dealing with an undiagnosed food sensitivity or food
mhm,
allergy. So maybe they have an allergy to spinach, even though on paper spinach is a powerhouse food.
mhm,
Even if you're eating something good and you have something going on in your system causing an allergic reaction to it, that can cause inflammation in the body. And
mm.
chronic low-grade inflammation can throw off everything.
Yeah,
So those are the big three. I mean, there's a lot more that trickle out from that, but
yeah.
without good nutrition, a good gut, and good sleep, and again, obviously, moving to exercise,
Mhm.
very, very important.
Yeah. So we could say the top four. Get moving, because we know that exercise decreases stress as well, and is helpful in so many ways. So those are all great. This is such an important topic, and fascinating information, important for us parents and caregivers to know. So I appreciate your diving into this with us today. Where else could listeners go if they want to learn a little bit more? Are there books? Are there articles? Like what should we Google, so to speak, and what other information is out there that, that you could recommend that our listeners kind of go after?
I'm always a fan of PubMed's website. That's a government website where it has high quality journals, so that's a place to find high quality journals and just typing in some of these keywords. That's a good starting point. Talk to a functional specialist. Maybe they have a recommended reading list. Google Scholar is a great resource I like to use to find scholarly sources. You can find things on YouTube. It's kind of hit or miss. You really got to know your stuff after you listen to it. And you can tell, like, yep, this person gets it, or this is a little far out there. So fact check, verify, consult with your healthcare providers before like listening or reading something online and then taking
Mhm.
it and applying it because some of this stuff has been researched heavily with certain populations, but a lot of this stuff hasn't been researched particularly with an FASD brain. So we just don't know on some of these things. In
Right.
theory, I
Mm,
mean, we know getting sleep, exercise, eating healthy is good for anybody, regardless.
mm.
But try not to go online and like you hear someone talk, hey, take this supplement. You just have no idea because what
Right.
happens if your child's on all these medications? Now you're giving this over-the-counter supplement and it interacts with the medications that
Mm.
are on. You don't want that to happen either.
Right. So always consult your healthcare provider for
Yeah.
sure. Before taking even a supplement. But do your research. I think it's great to, I agree, being curious. I've been reading a book about anxiety in the brain. One of my kiddos tends to have high levels of anxiety. And while the book is fascinating, I'm keenly aware of the fact that the things that they're talking about is, not about a brain that was prenatally exposed to alcohol, because that's a game changer, with the brain. So it's like, but a lot of it still comes down to exercise, deep breathing, proper nutrition, sleep, all of those things even apply, with that. So straight across the board, we can improve a lot of things by focusing on those things that you often tell us about.
Hormones and anxiety go hand in hand, the
Yeah.
research shows.
Yeah.
Does that book say anything about hormones in it?
Um, I don't think I've read anything about hormones yet, so I'm not finished with it. I'll now be looking for it. But
And blood sugar levels. That,
yeah,
there's a lot going on with that and anxiety.
yeah, fascinating stuff for sure. I don't even know if we've done an episode together on anxiety. Is that a topic that you talk on as well?
Yes, and
Yes.
I've worked with many, many people with anxiety. Probably the most commonly diagnosed mental health issue out there,
Yeah.
anxiety-based disorders, followed by depression.
Yeah. So maybe we'll add that to our list of future topics to tackle for sure. We always appreciate you unpacking the topics and really giving us this wisdom. We're so grateful, Dr. Jerrod Brown. And so thank you for
You're
being with us
welcome.
today. But as we wrap up, before I let you go, anything you want to add on this topic of hormonal dysfunction in our kids?
More times than not, they're probably going to have it if they have these complex histories. So, unfortunately, another thing all of you should probably learn about. It gets overwhelming with learning about like the ACEs research and the
Mhm.
HPA axis and attachment theory, but this is one put at the top of your list because I think not only does it impact a lot of your kids, it probably impacts you too if you're dealing with a lot of stress and you're not getting a lot of
Mhm.
sleep. Definitely, the
Yeah.
more we can help our hormonal health get better, it's a foundational topic to helping just live a much more healthy, well-balanced life.
Yeah, I concur. So again, thank you so much, Dr. Brown. We appreciate you being with us again today. We're looking forward to having you back next month to tackle another topic that's so important for us foster and adoptive parents and caregivers. So thank you again for being with us today.
Thanks for having me.
Oh, we always have such a great conversation with Dr. Jerrod Brown. I know that you probably got a lot out of that. If you're watching the YouTube video of this, you'll be seeing my head down a lot because I was taking notes like I always do, and I don't know if I'll be able to read my shorthand, but just so much stuff to unpack. And I always do see a pattern. We really, no matter what's going on with our kids, focusing on, what about their sleep? What about what they're eating? What about the gut? Are they getting exercise? Are they, staying away from the sugar? Are they drinking enough water? Just those basic things can be game changers as well. And that's a place that we can all start. And of course, reach out to your doctors, their doctors, before pursuing anything else. But these are things that we really need to take into consideration with our kids, because I'm sure you can see it. I know I see it in mine. So these are very important things that we're tackling. So I hope that you were encouraged, and inspired and learned a little something from our conversation with Dr. Jerrod Brown today. Make sure that you share it with your friends that are adopting and fostering as well. Remember, I am here to encourage you and equip you for your unique parenting journey. On this journey with you as a mom of two young adults with FAS, fetal alcohol syndrome. I also have professional training as a facilitator of the facets neurobehavioral model, which is a brain-based approach to parenting and supporting our kids, understanding what the brain has to do with the behaviors that we're seeing. And, I know it's a hard journey, and that's why I'm passionate about providing the FASD training and resources that we have, because I didn't have these things in the early years of parenting my kids. And it wasn't until, they really became teenagers, even though they had their diagnosis, when they became teenagers. And I'm sure hormones had something to do with the increase in, crazy that was going on at home. But at that point, I was desperate and had to find out more, had to do my deep dive. And thankfully, by then, there was more than just the dark and hopeless stuff on the internet that, in those early days when I didn't get much from our developmental pediatrician with the diagnosis other than a pamphlet on ADHD and, have a nice day. When I was searching the internet, the only things that were coming up way back then were hopeless and dark. Things like, most likely they would end up in jail or addicted to drugs and alcohol, suicide, involvement in the criminal justice system, all this hopeless stuff. And that does not have to be the case for our kids, but we need to start early and educate ourselves and begin to accommodate and support them and understand that when it comes to prenatal exposure to alcohol and other drugs, it alters the brain. So the behaviors that we're seeing are symptoms of a brain-based condition, and we need to support the individual with the disability. So there's so much that we need to learn and can learn, and we must continue to learn. So I hope that you will do that. I do have the training, I have the parent coaching, all of those things in the support group can be found on our website, justicefororphansny.org. I hope that you will check it out. There of course is a link in the show notes, and my personal website where I blog about these things, sandraflach.com. So I hope you'll check those out. Feel free to reach out to me if you would like to contact me. Maybe you just want to share on how helpful this podcast has been to you, or maybe you want to tell me that you're needing something more, or you have a topic that you would like us to tackle, or maybe a particular guest you would like me to interview. I love to hear from our listeners. Love it when we hear how supported and how you feel that you've learned something that you can then apply and help your family. So feel free to email me. My email address is my name, Sandra Flach, at justicefororphansny.org. Also a link in the show notes for that. And please find and follow us on your favorite social media platform. Justice for Orphans is on both Facebook and Instagram at Justice for Orphans. I am on both of those platforms as well at Sandra Flach. So I hope you'll find me, friend me, follow me, all those good things. I would love to connect with you. I am so grateful that you spent your valuable time with me today. I am grateful to have you along on the journey.
Thank you for listening to this episode of the Adoption and Foster Care Journey podcast, brought to you by Justice for Orphans. We hope you were encouraged today. Please be sure to subscribe to this podcast and leave a review, and share it with your fellow foster and adoptive parent friends so they can be encouraged too. Be sure to find and follow us on Facebook and Instagram at Justice for Orphans, and check out our website for vital resources at justicefororphansny.org.